Good morning. I'm Peggy Cox. I'm a respiratory therapist and a nurse and work in the pulmonary rehab department here at Frazier Rehab. Today we're going to demonstrate the peak cough flow maneuver. What I have is a low flow peak flow meter from Philips Respironics, the Access. This maneuver, or this peak flow meter, measures in liters per minute, anywhere from 0 to 390. There's a couple mouthpieces in the peak flow meter. You won't be using those. We have also a standardized disposable mouthpiece that you will use with each of your patients. Now, when you get ready to do the test, you're simply going to put your mouthpiece straight into your peak flow meter. It will not let you put it in wrong, only one way. You want to be certain that you have zeroed your peak flow meter, and that takes place by just dropping the small little indicator all the way down to the 0. You're ready. Now, what the test is going to measure is the amount of air that can be pushed out whenever a patient is coughing. So it's not measuring exhalation, which is typically done with a peak flow meter. Again, the maneuver is actually instructing your patient to cough while they're after they've taken a very deep breath in. So what we're going to have your patient do is sit upright at 90 to 100 degrees. Be again sure that you zeroed your peak flow meter. Basically, you'll instruct them to take a big deep breath in, seal their lips very tightly around the mouthpiece so they have no leaks, and to cough. Not to exhale, but to cough. Now, I have Alice with me today, and she's going to demonstrate the use of the technique of the peak cough flow. Again, make sure that your patient is comfortably sitting upright. Are you ready to do the test, Alice? What I want you to do is I want you to take a very good deep breath, big deep breath in, seal your lips very tightly around the mouthpiece, and cough. I will actually tell you exactly what I need you to cough, okay? Don't just exhale, but cough. Be certain that you do not have your hand over the end of the peak flow meter. You do not want to occlude any of her air. All right, if you're ready, big deep breath in, lips real tight, cough. Good job, Alice. Are you doing okay? Perfect. So what Alice, the flow that she coughed was at about 355 liters per minute. Now, we want to be certain that we can get three maneuvers that vary by less than 10% to validate our information. So you're going to let your patient rest for about a minute, and then you're going to repeat again. Remember, zero your peak flow meter. If on the second consecutive trial, the peak cough flow worsens or decreases by greater than 10%, you need to stop the test. After the rest period, give about a 3-minute rest period, and then repeat the maneuver again. If the peak cough flow continues to improve, continue to repeat the maneuver until the variation holds at 10% or less. This will rule out fatigue from repeating the maneuver several times. If after the rest, the pressures do not change by more than 10%, the best value becomes your peak cough flow, and that is what you will enter into the ITW documentation system. As far as after the test, the mouthpiece is going to be discarded. The peak flow meter will actually get cleaned with an antiseptic wipe and will be reused between patients. But again, remember, you do not want your patient inhaling through the peak flow meter. It is just exhalation, just the cough maneuver itself. Thank you.